Hello everyone, this is Bhavya Sharma here from the Med Concepts with Bhavya. You already know me and you've heard my voice a lot of time, but today I'm on this screen because we are going to talk about something, and the topic that we're going to discuss about is physiotherapy. So physiotherapy as a course and the scope of physiotherapy, and whatever experience and knowledge I have about physiotherapy from the last 4 years of my experience. Before telling you about my experiences and my knowledge, I would like you to know that I am a final year student of physiotherapy and my internship is due. So I hope my experience and the knowledge I have gained will help you understand whether this is a field you aspire to go into. So without any further ado, let's get into the video. So this is my notebook in which I have written everything that I would like to share to you guys. Okay, so first things first, what is physiotherapy? Physiotherapy is a healthcare profession, and the work of the therapists, that is the physical therapist. You are also known as physical therapist or physiotherapist if you do physiotherapy, like if you study physiotherapy. So these therapists are those people, are those healthcare professionals who help you bring back your functionality, who help you gain the muscle strength, who help you gain the range of motion of your joints after you have been injured. So they bring back the functionality of the body or of the joints or whatever joint has been affected or muscle after you have gone through an injury. In a simple manner, this is what is physiotherapy. So let's talk as an example. For example, you have had a fracture, neck or femur fracture. Okay, neck or femur fracture, and then what would be the first thing that would be done is you would be taken to a orthopedic surgeon who will do the surgery, whatever required surgery, and then after a particular amount of rest period you would be recommended to a physical therapist. Why? Because you would have lost your muscle strength, you would have lost your bone strength, you would have lost your daily activity strength, and you would have lost your functionality after the fracture. So, all these four segments that I talked about would be rehabilitated or would be brought back to normal levels or even more stronger levels by your therapist. So, that is the role of the physical therapist. I hope that is clear. So, the next thing is what physical therapy involves. Like, if you are a physical therapist, what is your role? Number one is you diagnose the problem, you prescribe them exercises. There are also techniques like manipulation and manual therapy. There are a lot of techniques that you study, and there is also something called electrotherapy, in which you have electrotherapy devices like IFT, ultrasound, laser therapy, etc. So these are the things that a therapist provides you when you are their patient. Okay, next up is what is required, what is the education required to become a physical therapist. The very first level of education that you require to become a physiotherapist is baccalaureates in physiotherapy, which is also known as BPT. BPT, everything will be mentioned on the screen as well. So baccalaureates in physiotherapy is the first level. After you clear this particular course, you become a certified physical therapist. Followed by this, if you want to do masters in a specific field, you do masters in physiotherapy, and in some countries it is also known as doctorate in physiotherapy, like in US, and in some countries it is known as masters of science in physical therapy, like in countries like UK. So this is the second level. After that, you can also do PhD if you are interested in becoming a professional teacher, that is a faculty member, or a researcher in the field of physical therapy. So PhD for that. Now talking about the duration of the course, before saying that, I'm talking about the physiotherapy course specifically mainly from India. Okay, and because idea about the other countries much, and I have idea about India, so I'm talking mainly about the course in India. So the course duration for BPT is 4.5 years, and 4 years is of your education. That is, you will have sem wise course. That is, I had totally of 8 semesters, and then after crossing the 8 semesters, I will have a half year, that is 6 months of compulsory internship in hospital. Next up is the most important thing when you start to think of physiotherapy. What should be your eligibility? Your eligibility should be, you should be +2 passed, that is 12th passed, with mandatory subjects, that is physics, chemistry and bio. You don't need to have maths compulsorily, but these three subjects are compulsory: physics, chemistry and bio. I was a pure science student. I did not have maths. I just had physics, chemistry, bio, then Hindi and English, and I was eligible for the course. So this is the eligibility for the course. This is the eligibility. This is the subjects you require to go into or to even think of getting into physiotherapy. Now, some of you may ask me, what is the percentage required? See, every college has different percentage they ask for. I'm talking about the minimum percentage to get into the college. So for my college, I am a student of Savita College of Physiotherapy, which is in Chennai. And in my college, 70% aggregate marks in 12th was important. So I had 81.2%, so I was eligible. So all the students who were 70% above were eligible to write the entrance exam. The entrance exam was just college level, and it was not all India level or something. It was college level entrance exam, and we were eligible to get into the course. Next up, we'll talk about the curriculum. Curriculum in the sense, what subjects you will be studying in the physiotherapy course. I'm talking about bachelorates in physiotherapy. Okay, so first 2 semesters, you will be going through all your basics, anatomy. This is my favorite dialogue. I've always said to all of you, whoever follows my channel to study lectures, that anatomy is the basic, physiology is the basic. So that is the basic. Anatomy, that is human anatomy. You totally have 4 books of anatomy, physiology. Then you will also be studying psychology, because basic psychology is important for us to study, because we have to manage the patients, so we should know their psychology and how to handle it, at least basic psychology. So 6 months of psychology also we have. I will have the list on the screen where you will have all the subjects. See, remember one thing, I am talking about my curriculum, and I am a 2018 batch student. Now my juniors, my sub juniors have some new subjects as well in their curriculum. For example, they have oncology in the sense for the cancer patients, so physiotherapy for cancer patients. So there are some changes that keep on happening year by year, but basically you will have anatomy, you will have physiology, biochemistry, sociology. Then in the next year you will be having general medicine, pathology, microbiology and all that. And then you will have clinicals. You will have the subjects as clinicals, and then you will have the PT in it. So by PT I mean, for example, in my 6th and 7th semester, in my 5th and 6th semester, that is my 3rd year, I had OBG, that is gynecology, cardio, that is cardiovascular and respiratory health. Then I had your this thing, general surgery and everything. They were clinicals. I was studying the clinicals. And then in 7th semester, I had PT, that is physiotherapy in gynecology, physiotherapy in cardiology, physiotherapy in orthopedics, all those. Okay, whatever specialities you have in physiotherapy, you would be studying a bit of that in your BPT curriculum as well. When you go for your masters, then you will be specifically studying about the subject that you choose. For example, if you're choosing to get into masters of physiotherapy in orthopedics, then mostly you will be focusing on the orthopedics. But when it comes to physiotherapy as a bachelorate, you would be studying about everything in bits and pieces. And then in the last semester, that is your 8th semester, which is the most crucial semester as well, you would be studying about diagnosis, that is physical diagnosis, how you diagnose a patient. because diagnosis is the most important part of medicine, because when you diagnose well only you can treat well. So you have physical diagnosis. We have an elective subject also. We were given choice between nutrition and PT in dentistry, that is physiotherapy in dentistry. I have taken physiotherapy in dentistry because I'm interested in dentistry. And there is nutrition also, in which you talk about all the things like biochemistry, Krebs cycle, nutrition, and all that things. So these are the subjects that you go through. I'll have a complete clear list here. You can see it here, and I will also upload it in my Instagram account. You can see it there also. Link will be in the description. Also, I forgot a very important point. In my career, I started it from my third semester. That is my second year, which is clinical posting. That is, I am posted in the hospital. I wouldn't be treating the patients, but my PGs, that is the postgraduates, and my faculty would be treating the patients, and we would be there observing them. We would learn how to talk to patient, we would learn how to take the diagnosis, we would learn how to do the assessment and everything. We would not be the the main hand in the therapy that they are doing for the patient, but we would be observing our seniors and our faculties doing it so that we can learn it. So we would be having hospital postings at least 6 hours in 1 week in hospitals. In my college we have hospital of our own, so we were posted there. So that is what is clinical posting, a very crucial important part of our field. So yeah, clinical posting. And then we will also, yeah, I also want you to know about some interesting factors of physiotherapy. As often we will have practical classes as well. We will be like, one of our own classmates will be a practical model, and we would be doing exercises on him or her, or whatever we learn, that practical. And anatomy and physiology in the first year, the practicals are very fun. You'll have the brain in your hand. You'll be seeing the, mostly you will be seeing the dissected brain, because the dissection part of the study comes in MBBS. So those guys use the cadaver and the parts of the cadaver. Cadaver means dead body, but in medical field you respect the person who is dead, and you call their body cadaver. So it is cadaver. So when you go to the anatomy dissection hall, you will have the dissected brain, or you will have a heart, lungs, kidney and spleen, and you will be studying about it. So you will be seeing all those things and learning about the ligaments, the muscles, the arteries and all that. Like literally you have it in your hand, and it's just beyond the words experience, especially for me. There were people who fainted actually. There were people who did not like the smell. There were people who couldn't handle it. But for me personally, it was a very, very beautiful experience, like unforgettable experience. Now let's talk about employment. See, since I'm not yet employed, and since I'm still a student, I don't have a personal experience about the money you earn and the employment and everything. But I have talked to my faculty, I have heard a lot of workshops, and I have researched a lot, and I get to know it, that this is the employment level. So I would just share it to you in that way. So I have it written here, so I will just read it out from here. I have an estimation, okay, from the research I have done. After bachelor's of physiotherapy, that is the first level, you would be earning about 3 lakhs to 4 lakhs per year. After masters of physiotherapy, you can go from you can go till 9.8 or 9.9 lakhs per annum, and minimum can be 1.2 lakhs or something. So 1.2 lakhs to 9 to 10 lakhs per year. And after PhD, it is about 2.5 lakhs to even 30 lakhs per annum. Actually, a personal thing that I want to tell you is, I have seen a lot of people who are working in this field. There is one person who is working and earns average amount, that is about 4 to 5 lakhs per year, and there is another person who is earning about 15 to 20 lakhs per annum. So what I'm trying to say here is, this is what I believe in. It depends on your talent, and it depends on what you are doing. Okay, so there is a teacher of mine, who I idolize a lot. He is a professor. He's a principal. He's a principal plus professor, He has clinics, I think one or two to three clinics where different physios are working. He has branches, and he is also a specialist in a therapy which is known as Mulligan's therapy, Mulligan's technique. It is a manual therapy technique, and he takes workshops on these. And he's a speaker, like a public speaker in physiotherapy. So all in about, he's very successful, and I believe that he must be earning more than 50 lpa, right? And then there are people who are just newly experienced, just have come out of the student zone, have started working. They must be earning 10 to 15,000 or 20,000 per month. They must be earning 10 to 15,000 per month. Please, I know money is important. I'm a very money minded person, and I, as a woman, I really want to become independent and have the money of my own. But with money, other things are also important. Things like your fame, your name, your respect in the field, and everything else. So, and when you are talented, the money will follow you. So focus on knowledge, money will follow. That's all I would say personally. So focus on learning things, focus on your skills, money will anyways follow. Now the last thing that I want to talk about is specialty. You would have known about MBBS. In MBBS, after your MBBS, you do postgraduate in a specific specialty you are interested in. For example, pediatrics, MBBS pediatrics, right? They do PG in pediatrics, that is in children's health. Gynecology is women's health. Ortho is about bone and joints, right? So there are different specialities. Similarly, in physiotherapy as well, we have specialities. So some of the specialities are hand physiotherapy. That is only this much. This is the hand. They are the specialist of the hand. So whatever problems comes with hand, that would be coming under the specialty of physiotherapy, hand. I don't want to go dig deeper into it, because you'll get to know it if you go into physiotherapy field anyways. And very common fields, the most common fields are neurology, that is masters in physiotherapy in neurology, in pediatrics, in gynecology, in orthopedics, in manual therapy, then in this thing cardio, MPT cardio. And there are a lot of new masters courses emerging now, that is in dentistry, in oncology. All these things are also emerging now. Okay, so there are a lot of specialities that you can follow up when it comes to doing your masters. The other thing is, I know there must be people who would be thinking, how do you get into MPT, how do you get into BPT and all that. I have told you the basic about how to go into BPT. And about masters, even I haven't started my masters yet, so I'm not that exposed into that field. So when I start my masters, that is in 6 months to a year, I would be sharing my experience about masters as well, the entrance exams and the best colleges for specific specialities, etc. etc. But for today, I just wanted you to know about what physiotherapy is, and what is the scope, and what are the courses inside it, and how it can help you build a future in it, and all that. So I hope this was helpful. So if you want to take a note to home, personally I would say physiotherapy is a very beautiful course. It's a very growing course. The people are understanding the importance of it now, that physiotherapy is very important in life. And yeah, in specialty, I forgot the one of the most famous specialty, which is sports, physiotherapy in sports, masters in physiotherapy in sports. So yeah, according to me, it's a very good course if you are wanting to help people, if you're wanting to relieve their pain, if you're interested in medicine, if you're interested in exercises and muscles and joints, then please go for it. It's a very good course. I personally enjoy studying it. And I know the most important factor is scope. Everybody is worried about whether I'll earn in it or not, whether I'll earn enough to fulfill my dreams or not. Yes, you will. And there is a good scope, and it depends on you and how you learn and what you do with that course and what you do with your brain, that will define how much you earn, and that will define your level of success. That is what I would say. So yeah, if there is any other details you want to know, and if there is any doubt, or if there is anything else that you want to know, please comment down in the comment section below. And I hope you liked this video. If it was informative in any way, please give it a like. And if you're new to this channel, I hope you subscribe, and we'll see you in the next video. Thank you. Bye bye.